So good evening, Columbus. Welcome to Building Our Reproductive Freedom in Columbus Town Hall. My name is Devontae Jennings, Youth Organizing Director for Men for Choice, and I'm proud to be here tonight alongside some advocates, organizers, and community leaders who believe that every person in Georgia deserves the freedom to make decisions about their own body and their own future. Tonight is about more than just policy. It's about people. It's about the stories, the challenges, and the ideas that shape our fight for reproductive justice here in Columbus and across the state. We are here to listen, to learn, and to build together. We're here to build a vision where everyone, no matter their zip code, their income, their background, can access the care that they need to be supported without shame or barriers. So, with that being said, I want to thank you for being a part of this conversation. Let's make this space powerful, collaborative, and a solution-driven place. Because the fight for reproductive freedom in Georgia starts with all of us. And with that being said as well, I'm gonna go ahead and lay over a little overview so that way you know what you're getting into tonight and you know why you came here to the library tonight. So we'll be getting grounded in why we're here and what's the landscape of reproductive health and access in Georgia. Then we're gonna give a brief overview of the shared campaigns, which is the RFA, the Reproductive Freedom Act, and the FCS, which is Fake Clinics Suck. Then a panel discussion, a Q&A with all you beautiful people, and then we'll close with calls to actions and next steps like good organizers do. You'll see we have videographers here as well. So if you are willing to share any stories, make sure you find one right there. There he is, put your hand up, boom, boom, boom. And then the other one, where is he at? There he is. All right, so please, if you feel comfortable, share some stories with the camera, please. Few logistics really quickly. We want to first, for allowing us to be in this space, the gracious Columbus Library. This public library, we support public libraries. Give a silent clap, library clap, library clap. There you go, there you go. Support your libraries, keep libraries alive, get a library card, please support the library. I also want to let everyone know that your restrooms are gonna be out of these doors. You're gonna take a left, then you're gonna take a left again, then you're gonna take a smidge right. Left, left, smidge right. Got it? All right, and then right here you'll have the exit. So just in case you see the exit sign, follow this way, and then bust it right. Clearest exit through. All right, and I also would like to give a big shout out to our partnering organizations for tonight. We have Feminists, we have Urge, Spark, Men for Choice, Reproductive Freedom for All, Color of Change, and Amplify Georgia. Now, I'm gonna welcome Destiny from Color of Change, who's gonna be another host for us this evening.
Good evening, everyone. Thank you all so much for joining us. My name is Destiny Newell, and I'm a senior campaign organizer here at Color of Change. I want to start our evening off with just a quick introduction to who Color of Change is for folks who may not know in the room. Color of Change is the nation's largest online racial justice organization. And we are committed to fighting for a world where it is more fair and more equitable for Black people. And so our campaigns and our work is focused on that. And so with that, we've been partnering with different groups around our Liberated Bodies work. You all see on our wonderful collaborative table with all of our different resources for tonight, a pamphlet around liberated bodies. And I just want to take a quick moment to frame a little bit about the reproductive justice fight and the position and place that Black women have held in this fight. When you think about reproductive justice and freedom, you have to start with Black women and the fight that Black women have been in since the 1840s. And so at Color of Change, Liberated Bodies is our theory of work that centers that fight and that in a space and a time where our history is actively, there is an attempt to erase our history, there is an attempt to rewrite the history that we all know, or some of us don't know. We are standing 10 toes down on reinforcing that history and reiterating how long this fight for reproductive justice and reproductive freedom has been. So I will encourage you all as we go through our different campaigns tonight that are specifically aligned with Georgia and that specifically impact Georgia to really think about this history as you're framing the fight. And so I'm just sharing this quickly where we are today. And so we're going to talk a little bit more about this in our different campaigns. But as we go through the timeline here, you'll see that today we are in a space where Black women and women are being punished for pregnancy decisions. And so with that, I am going to actually ask Allison to come up with Amplify Georgia to introduce and talk a little bit more about the campaigns that are happening here in Georgia. What's the fight here on the ground in ways that you guys can tap in and get involved. And we're going to have a wonderful evening and some robust conversations. Thank you all for joining us.
Love it. Hi, everyone. My name is Allison Glass. I have the privilege of being the state campaign director with Amplify Georgia Collaborative. We are a collaborative, meaning that we are made up of many different organizations, and I have the absolute honor of getting to work with all of the organizations that are here tonight. We work together collectively on several campaigns because we are more powerful together, right? And that includes all of you in this room. So thank y'all so much for coming out and being with us and having us here in your town of Columbus. We knew that it was so important to come to Columbus because you all are really central to Georgia getting the access to the care that every person across the state needs. And so that is what we are here to talk about tonight. We just launched a new website called stoppolicingpregnancy.org. You might have seen a billboard that looks similar to this. Yes, amazing. Saw some billboards. You might have seen a social media ad that looked something like this. Because as Destiny was just saying, pregnant people in Georgia are being investigated, whether they are having an abortion or if they are having a miscarriage. And that is absolutely abysmal. Anybody seen? Yep, here's our billboard. We also sent out some mailers. Anybody get a mailer from us in the mail? Yes, you did. I love it. This is what our mailer, so these are some of the campaigns that we're going to be talking about tonight. And we knew that we have to, again, dig in on the ground across this state. It is not just about Atlanta. And so that is why we were in Augusta last night, and we're so happy to be here tonight in Columbus with you all. So we also, what we know, right, is that right here in Georgia, in Tift County this year, and in Columbia County in 2024, law enforcement in Georgia opened investigations when women went to the hospital after experiencing a miscarriage. And last year, an expert review committee determined that Amber Nicole Thurman's 2022 death in Henry County, a nearly 20-hour delay in emergency treatment, could have been prevented. We know that punishing people for their pregnancy outcomes, whether it's for abortion or miscarriage, does nothing but cause harm. And these laws, including abortion bans, because once you ban something, once you put it into law, and as we'll hear about more, our abortion ban laws are in criminal code, right? That means we're not dealing with healthcare in these situations. We're dealing with criminal outcomes and the possibility of prosecution. We know that that only hurts pregnant people, and it also causes, and what we're seeing is that even for providers, it's causing delayed and denied care and a lot of confusion that is causing people's lives. So we have to change this. So what we also did is we did some polling right here in Columbus, and I want to share some of this information with y'all. And this polling informed this education campaign that we did and all of the outreach we've been doing. So this was of voters in Columbus, split across party line, racially diverse, age diverse, all the things. 83% of Columbus voters think that improving Black maternal health and mortality is critical. Restoring abortion access in Georgia is important to 60% of people in Columbus. 92% of Columbus voters believe that you can hold your own personal beliefs about abortion and still support a person's right to legal and accessible abortion. 86% of Columbus voters believe the person who is pregnant is the best person to make the decision about their pregnancy outcome and accessing abortion or not. And 80% of Columbus voters believe health care should never be criminalized. So I want y'all to take this and know that we are in the vast majority. We're in the vast majority right here in Columbus, in your community, and across our state and across our country. So the work, right, is really to talk more about these issues with our communities, with our neighbors, with other folks that we are connected with, and then to keep talking to decision makers so that they will be aligned with what the people want. Because that's their job, right? Really, they're supposed to work for us because they represent us and they need us. They need our votes. And so we're really the ones that hold the power. And so that's what we hope that you get out of tonight, is knowing that there is so much support behind these policies, and we're going to keep fighting for the Georgia that we all deserve. Thank you so much.
We are going to do our transition into the campaigns that you heard a little bit about, but these two experts are going to come and dive in a little bit more for you. So first, I would like to introduce Chris.
Hey everybody! My name is Chris. I work at Feminist Center for Reproductive Liberation. We are an independent abortion clinic in Atlanta. My job as the public affairs manager and lobbyist is for me to go into the Capitol and fight against regressive policies and fight for progressive policies. I also have the privilege of being a co-chair for our Reproductive Freedom Act campaign. So the Reproductive Freedom Act is a bill that we introduced in both the Georgia House and Senate. The bill numbers are on the screen, but HB 598 and SB 246. This is a piece of progressive legislation that was born out of really looking at the different pieces of our Georgia code that affect people's access to abortion. These are all of the organizations that are involved with the campaign, many that are here today, some that are not. I'm sure that you recognize some of them. And yeah, so we have a lot of good representation, people who are very invested in the reproductive freedoms of Georgians. Can anybody shout out, or we're in a library, so maybe not shout, something that exists in our Georgia law that is a roadblock to people receiving access to abortion? Medicaid, yes, exactly. RP ban. Oh, that's nice. I like that. Okay. Our videographers probably don't like that. Okay, cool. Okay, those are two great examples. Here are some more. So in Georgia, we have provider restrictions, and what that means is that only doctors, so only MDs, can provide abortions to people in Georgia. Out in other states, physician's assistants are able to provide abortions, so many providers have abortion in their scope of care, and because Georgia only requires MDs to provide abortions, it makes it so that there are less providers in our state. Just touched on this, but folks who have Medicaid cannot use their insurance coverage to have an abortion. Folks who have a marketplace insurance cannot use their insurance to cover an abortion. As Allison touched on earlier, abortion is listed in Georgia's criminal code. I believe it's the only healthcare procedure that is in our criminal code. We have a mandatory 24-hour waiting period. So if somebody is seeking out an appointment with us, we have to talk to them 24 hours before they can even come into the office. And in that call that we have with them, you'll see later that I say biased script. We have to read to them a biased script with medically inaccurate information about what could happen to their body based off of junk science. It's mandated by the state. It passed I I think 2008, 2010, it's the Women's Right to Know Act, and it's based in junk science. We also have forced ultrasound, so if you're seeking an abortion, you have to have an ultrasound. You cannot deny an ultrasound. You don't have to look at it, but you have to have one. That bias script that I just touched on. Our 6-week or less ban, it's colloquially known as the heartbeat ban, and it can be as early as 2 to 3 weeks if fetal tones are detected in someone's ultrasound. It's much earlier than many people know that they're pregnant. We also have mandatory parental notifications, so if a young person is in danger in their home and is seeking an abortion, they would have to have their parents notified that they're having that procedure, and if they decide not to, they would have to have something called a judicial bypass, which means that they have to go in front of a judge and ask for permission to have an abortion, and usually that can take weeks. And if you're in an area that has a judge that's maybe not so friendly to reproductive justice and abortion, it is a slim to zero chance that you'll be able to have what you need. So how does the RFA come in? The RFA was born out of digging through our Georgia code to try and find anything that would block access to abortion. It would make it so that people have the exact things that they need in order to get care. It would make it so that people have, every person who becomes pregnant in Georgia will have the right to choose to carry their pregnancy or the right to have an abortion. And it would recognize that people are different in their pregnancies. It would expand access to abortion care in insurance, in providers, make it so that people are able to have the type of care that they choose to have and not are forced to have. Would also repeal all of those medically unnecessary and harmful abortion restrictions that create barriers to care. 95% of Georgia counties don't have an abortion clinic. Columbus does have, I believe, one. The majority of them are in the metro Atlanta area. And half of all Georgia counties do not have access to care with an OBGYN. So aside from having to possibly try, I mean, I'm sure that your clinic is overloaded here in Columbus. So if people are seeking care and they're not able to get an appointment, they may have to travel. And on top of that, people are likely having to travel to have regular gynecological care, regular wellness visits in other counties as well. 2024 polling shows that the majority of Georgians support abortion access, and 4 in 5 Georgians feel that their government should not interfere with someone's abortion decision. As Allison touched on earlier, we are seeing people being criminalized for their pregnancy outcomes, and the RFA would make it so that when someone has a pregnancy outcome that could be criminalized now in code, that would be taken out. Abortion would be put under the health code and not the criminal code. So, in conclusion, our big chunk that we want to pass along to y'all in messaging is that when someone decides to have an abortion, they should have everything that they need. They should have access to timely, safe, legal, and affordable abortion care, and they shouldn't have to face systemic violence. They shouldn't have to face shame or stigma or punishment or investigation. And we know that this is a very long-term vision, right? We know that this is not going to pass in the next couple of years, but the reason that we're here and the reason that we're putting boots on the ground around Georgia is because we believe that this is something that's possible in the future, and we need everyone's help to do it. Our need for abortions hasn't gone anywhere in the past and is not going to go anywhere, and we aren't either, and we need your help. We're not going to leave anyone behind, and that's the point of the RFA, is that it touches all those different things that need to be touched. So, yeah. Please scan if you would like, but we also have the QR code over there, so don't rush. Yeah, thank you.
Hi, everyone. Can you hear me? My name is Alexia. My pronouns are she, her. I am the Policy and Law Fellow at Spark Reproductive Justice NOW. My boss, Agbo Ikpor, who is the Policy and Advocacy Director over at Spark, is actually the chair of the Paid Clinic Suck campaign, but she's on sabbatical, so I'm the chair of the Fake Clinics Up campaign. I'm here not to only talk about the campaign, but also do some level setting on what exactly are fake clinics. So first off, fake clinics are called many different things. So crisis pregnancy centers or CPCs, limited pregnancy centers, pregnancy resource centers. They're called whatever, but what they are fake clinics. They are nonprofit, usually religious affiliated facilities that disguise as reproductive health clinics that do not provide contraception, sexual health treatment, or abortion services. These facilities exist for the sole reason of pushing someone into a pregnancy regardless of their personal feelings before they walk in the room. That is the sole reason why these places were created and why they still exist to this day. So just to give you a little bit of history, these clinics have been around for a while. The first fake clinic was created back in the 60s, and since then they've only been growing. So like I mentioned, a lot of these facilities are religious affiliated, mostly Christian, and they're under these big three umbrella groups that you probably may have heard of: Heartbeat International, CareNet, and the National Institute of Family and Life Services, or NIFLA. So they basically create kind of these umbrella, I don't know what to call them, health companies, but they're basically like nonprofits that then create fake clinics. And some of them are managed by the same people, some of them are standalone. But a lot of them are managed and kind of funded by these three umbrella companies. So fake clinics are everywhere. They're in all 50 states, and there is no law that makes their existence or what they do illegal. Over 75% of fake clinics are linked to those three Christian nonprofit organizations that I mentioned. Just to give you some more stats, like I said, these clinics are fake. Less than half of these have legit medical professionals on staff at full time. And 95% of these clinics offer no prenatal services. And also, even though some of these fake clinics may list that they have a medical professional or medical director, a lot of the time, they're not on site. One of the medical directors we were able to find for one of the fake clinics in Georgia, the doctor lived in practice about 50 miles away, and we were able to find proof of that. But yet he's still listed as the medical director, i.e. the person who's supposed to approve all medical anything at these facilities is not even on site most of the time. So of course, we think of someone lying to you when you're going to seek any type of health. There's an issue with that. But there's so many intersecting issues that you'll encounter when you go into a fake clinic. One of the things is the adoption pipeline and the use of maternity homes. So if you've never heard of maternity homes, they're also usually faith-based. Their homes were, back in the day, whatever, when it was more taboo to be unmarried and pregnant. A lot of families will send their usually young daughters, but it could be any age, to these homes where they could basically be pregnant in the shadows. No one can see them pregnant and unwed. And basically would force these young girls or women to, regardless of if they wanted to keep the pregnancy, to carry the pregnancy to term, and then afterward to give the child up for adoption. So nowadays, even maternity homes are still around. Just recently in Georgia and Gwinnett County, they were given extra $10 million, I believe, extra money for the sole purpose of creating more maternity homes in Georgia. So there's still more maternity homes being created in our state. And now there's maternity homes that have their own issues. It is housing for pregnant people, but it's conditional on you keeping that baby. And a lot of them provide you with no resources after you're pregnant. So if say you're 5 months pregnant, they'll give you housing for those 4 months until you're ready to have the baby. And then after that, you're left with no housing. You're left back at square one again, having gone through a pregnancy. And once again, in these maternity homes, based on who you are, so if you're younger, if you're a person of color, if they deemed that you're not fit to be a parent, in some of these maternity homes, they will bully you into adoption. Or if they see you as someone coming from a more rich family, or you're white, and you fit all these demographics, they feel like, oh, you should have a baby, you can have one, you have this support. They'll then have what they call it counseling, but they pressure you to then carry this pregnancy into term, no matter where you're left at afterwards. And that's just ingrained in their practices and their intake at these fake clinics. There's also a lot of privacy concerns. They have created their own period trackers to track the menstrual cycles of people they think they are pregnant, and then collect their personal information in the app, so they can then target them with like emails and phone numbers. Be like, do you think you're pregnant? Come to our clinic. They've hacked into patient care systems of legit clinics before to get their client files specifically for those seeking abortions. And also, something really important to remember, these are not real medical facilities. They are not bound by HIPAA. You give them their personal information, they're not really technically bound to keep anything you tell them private from anyone in your family. They'll make up their own privacy statements. One I read that was from Georgia was so wordy, but basically said, yeah, we won't give any of your health information away unless we hear something that thinks we should call your parents or your partner or this and that. And they'll get all that information from you just so they can basically pressure you once again to have a child. But yeah, and then once again, and that's one of the key signs if you're going to a fake clinic or not. If you go to their website and there's no HIPAA privacy statement, it's probably a fake clinic. And then of course, these fake clinics cause a distrust in providers because when you walk into them, they're not going to be outright something different to any other clinic you've been to. Not all of them will have a cross or Bible quotes on the wall. It's going to look like a legit clinic. So when you go in, a lot of them think they're like these nurses or doctors are pressuring them, but they're still doing it based on what they're seeing as their health is. So as I kind of mentioned before, less than half of fake clinics are overseen by a licensed OBGYN, but even if they are over these fake clinics, they're not on site every day. And even if you go to some of these websites, you can't find when there is a doctor on site. So when you go into them, you're probably only interacting with a volunteer or if they call themselves a nurse. Like you won't even see a legit medical professional. And then there's an example here that I can touch on later more extensively if you want, but there's a case out of Massachusetts actually where a woman went in and then on the ultrasound, there was ectopic pregnancy. And it's still not clear whether they just weren't trained to find it or they didn't want to tell her because they didn't want her to get an abortion. But either way, they did not inform her that she had an ectopic pregnancy. A couple weeks after, she started feeling a lot of pain and a lot of symptoms, and she ended up losing her baby in a fallopian tube because this place did not accurately diagnose her ectopic pregnancy. And they found that fake clinic liable. And obviously, it kept a lot of it private, her name, the amount of money she got. But obviously, the worst part that we know is that this is actually a pregnancy she wanted. She went to this clinic to make sure everything was all right. They either lied to her or didn't have the requisite training to read an ultrasound, and she ended up not only losing her child, but a fallopian tube. And that is like just one story that we know of. There is just so many people who've been to fake clinics that don't even know if they've been to a fake clinic and have been harmed by them. So we're talking about fake clinics, they're everywhere. We gotta be asking, who funds these? Who pays for them? Look to the left, look to the right, look up here, because we all pay for them as taxpayers. First off, federally, they get federal funds through the Temporary Assistance for Needy Families, or TANF funds. It's meant to be like a public assistance program for low-income families. But no, they're diverting that money to CPCs. And that's not just in Georgia, that's like all over, any way they can do it. A lot of, like the state funded here. Over half of the CPCs in the country obtain some sort of state funding, and this is usually under alternative abortion programs or some type of grant program. So right now in Georgia, there's a grant program that awards these fake clinics $2.5 million every single year, and that's a recurring grant. That's this. I don't understand like the ins and outs of the funding. The way I just see it, they just keep like getting it. They don't have to put anything new. They just keep getting that money. And of course, private donations. That's like the license plates and things like that. But the weird thing about it is sometimes when people donate to these fake clinics, it's under the name of another broader entity. So we'll say like other church services or other this and that, but it's really going to fake clinics. So sometimes they're not even donating outright on paper to a fake clinic. But yeah, they get money from everywhere, and they are well-funded, millions of dollars.
We had the privilege of getting to hear from Chris and Alexia about the campaigns that were going on. And now we also have Mac, who is a Columbus-based community organizer and clinic escort for a local abortion clinic here, Columbus Women's Health Clinic. So can I get a silent library clap at Yale? Perfect. And I guess to introduce you to the stage, we'll just go ahead and start with you, Mac, the first question.
Okay.
All right. So, can you tell us about access on the ground here in Columbus? Where do people get reproductive health care, and what are the challenges for getting that?
Sure. So things are a little bit better for people in Columbus versus other areas in Georgia, because we do have an abortion clinic right by St. Francis. It's on Rosemont Drive. It's been there for about 40 plus years. So people can go there. However, we still do have that 6-week ban. It's kind of an ever-changing dynamic at our abortion clinic. We do share an entrance with an anti-abortion clinic. It's the same drive-in to get to both buildings. They are right next to each other. They share parking, they share an alley. If you sneeze, you can hear them. It's very close. For a very long time, it was a very rough environment. We would have 15 to 20 protesters out there on a regular clinic day. They had a giant RV that was an ultrasound bus. They would stop patients dressed in scrubs, like they mentioned earlier, saying that they were doing patient registration and try to mislead patients to their fake clinic. This has been going on for years. When Roe got overturned, it became a much more dicier situation because you became on a 6-week ban. So Georgia and the South in general is very limited on abortion. Most states, Texas, Louisiana, Alabama, they all have complete bans. So people are traveling that far to come to Columbus for a 6-week abortion ban. So the abortion clinic has appointments maybe 2 to 3 days a week. You drive from Texas all the way to Columbus, Georgia to get your appointment. You pull in, you have a woman in scrubs there saying she's doing patient registration. You go in her building, then you realize you're being conned. You leave her building and you miss your appointment for the abortion.
Oh, wow.
So you're on a 6-week limit in Georgia. You have to turn around and go home, make an appointment, come back the next week, because usually their appointments are scheduled a week out. So that's what things are looking like in Columbus. However, right now we are at a pause. The protesters haven't been out. They haven't been out since about November. We had a very dedicated group of escorts that were out there, and I want to say that they just kind of deterred them, that they stopped coming out. Sometimes we will have street preachers out there, but for the most part we've gotten very lucky. Now, I moved up here in 2016. This was going on from 2016 until this past November. It just became a much dicier situation as soon as the ban passed. You know, they can kind of work their way around it and come back to the clinic and go and do other things, but at this point it's just been very limited to them. One of the things that I'd also like to highlight, just from personal experience, is language barriers. There's a very large Spanish-speaking population here. I've had personal experiences outside the clinic where they'll just show up. They'll show up from hours away because someone told them there was a clinic there. They didn't make an appointment. Sometimes they don't have anyone they can talk to on the phone, and they just show up at the door. They want an abortion. They need an abortion. We've had escorts that speak Spanish. We've had people who have called friends to translate for them. Sometimes they'll show up. I had them one day. I was just driving by and I saw them standing outside, and so I went up and tried to talk to them. They didn't speak English. I got a friend on the phone who translated for them. I helped them order abortion pills online. I think the language barrier is an issue probably all across Georgia, but just something that I've noticed, I mean probably all across the South, but just something that I've noticed a lot in Columbus. You know, you already think resources are limited for English-speaking people, but then when you think of Spanish-speaking people and the fact that Spanish-speaking people are being attacked on a regular basis by the administration and, you know, just overall being targeted, and then they're out looking for an abortion, it's not an easy environment. So that's what I've noticed really as one of the major challenges around here.
Warren, I want to thank you for the service part, especially when you're talking about the safety aspect when it comes to that. So can we get a quick round of applause for the episode? And actually, since we're on that topic, I'd like to go ahead and kick a question over to Chris. I get the pleasure of getting to work with you, and I understand your passion behind the RFA, but it definitely sounds like there's something else there. Why can we not just go back to the status quo? Why is it the RFA? Why the RFA?
So when Roe was in place and we had our 22.5-week ban and then 12-week ban, we were treating, as we do like with our abortion law now, every pregnancy is the same. And we know that every pregnancy and every person is different. The RFA really hits on making it so that people have everything that they need and that we're not just chipping away at these awful things, and we're actually looking forward to like a future of abundance and taking care of people in every aspect of their lives. I think the RFA puts the patient at the center of care and not the state. It makes it so that they're able to receive abortion care with any insurance that they have at any age, at any gestational period, making it so that people are able to make informed decisions about their lives. And really like, so that people feel cared for, and that their decisions matter and that they are the reason that they're able to get care.
100%. Appreciate that one. Next to Alexia, quick question for you. And this is something I struggle with, and we had to, we talked about it earlier. I was like, how are you able to identify a fake clinic? So how can you tell the difference between a fake clinic and a real clinic?
So first off, let me say that it is hard because they're created to be deceptive. They want to look like a real clinic from the outside. So when you go in on the outside, sometimes they're like especially in Atlanta, they're nestled between legit medical professionals. So they're in a medical suite, and there's like a chiropractor and a dentist right around them, and in the middle there's like a fake clinic. But going back, so when you're first looking at one of the first things that will tell you a real clinic from a fake clinic, first off, like I said, a privacy statement. If you don't see like a HIPAA privacy statement or anything like that on the paperwork when you sign it or on the website, it's likely not a real clinic. So another thing on the website is they'll have kind of obvious, like the one here in Columbia, depending on how you pronounce it, they have abortion pill reversal. That's not a real thing. If that's on a website, that's probably a fake clinic. Or language. They'll always use personhood language when they're saying, sometimes they won't even say pregnancy. They'll say things like child and baby. And it's like in person and also on the website. But when you go in, one of the things like you may notice is that first off, you're probably not going to see a doctor when you go to a fake clinic because they don't have any. So if you go in and say, can I see a doctor, or what's the doctor saying that's over his place, and they don't tell you or they deflect, you're probably in a fake clinic because that's like common information they would give you. If you're in a fake clinic with an ultrasound and they're giving you an ultrasound and they don't let you see it, or they sometimes will, you'll ask, if you try to ask them questions and like they'll try to give you kind of dodgy answers, or sometimes that's another reason because a lot of them don't know how to read an ultrasound, so that's why they're doing it. Or they also have practices, if they do see a topic pregnancy, they want to get you out as soon as possible because they don't want to be liable for anything that may happen afterwards. So a lot of things around the ultrasound is something to look out for. I mentioned that personhood language, they'll say your baby, your child, instead when representing an embryo. I'm trying to think of some other facts. But the thing is, like I said, they are very meant to be looking like a real clinic. So there are still some people who have been to one and still have never realized that they've been to one, if that makes any sense. Like they'll walk away with not having an ultrasound and been to anything invasive, but they still have been harmed by a fake clinic. So I guess it's like as time goes on, you're seeing like the more practices and how like overt they become with their practices, but those are like the few things to be vigilant about when you're looking at the website or when you're going into a clinic.
Mm-hmm. So yeah, and then you kind of hit one of the questions too. Those are like the key red flags. Paying attention to language and presentation, basically. 100%. Okay, let's go back to Mac real quick. You talked a lot about the different type of barriers here in Columbus and some of the things and challenges that you've seen out here. So if I could ask you, what is your vision for reproductive freedom in Columbus?
So I would appreciate so there's two different things, it's in a perfect world of where we want it to be, obviously, would be abortion rights, that you're able to get an abortion, no questions asked, you can get what you need, support for if you decide that you want to have a pregnancy, and support for, you know, raising your child, because I think that reproduction is more than just pregnancy. But in the world that we live in right now, what I would like to see is, you know, just more overall discussion of it, more discussion to men. I think a lot of times men aren't aware of the options that are out there or what's happening in the overall environment. I think a lot of people just think in Georgia abortion's banned. Abortion's banned in the country, really, is what a lot of people are thinking. A lot of people don't know what's going on, and I think that helps to push the agenda that they want. You know, if you can't get access to it, you're on a serious time crunch, and you just think about everything that you have to do in your life. You know, you're trying to make time in your day to research this and figure it out, but your time's ticking by. So really, just at this point, with where things are, I just think telling other people, bringing it up in conversation, letting people know, hey, these are your options locally, but you can also order abortion pills online. That's like the biggest thing that I like to push is you can order abortion pills online. They're very easy to order online. They're $50 at most. Sometimes you can get them for free. That's where we're at in this current climate, that you kind of just have to cover yourself, order pills now, order pills for your niece, order pills for your granddaughter, get them, they last for a while, they're only $50, they make a big difference. And just bringing that up in conversation to people. I mean, like I said, in a perfect world, I really think that if things were better for pregnant people, if it was a more welcoming environment and a more supportive environment for reproduction, you would need less abortions. More people would decide to keep their pregnancy. But with where things are right now, that's not where it's at. I don't know if that answered.
No, I mean, you hit it right on here. And what can I tell you about what Columbus needs? You know better than I do. So, I think what I want to do right now, actually, though, is kind of, you know, scrap my questions, and I want to see if we can open up. Y'all cool with taking questions from the audience? Is there any questions from the audience that anybody may want to ask?
I have one. In Columbus, the Columbus Clinic, abortion clinic, you said that a Hispanic, you do have a Hispanic speaking person on staff?
So I think they have a Spanish-speaking person on staff now. They have one, but that's like something new within the last 6 months. They hadn't had one. We would have escorts that spoke Spanish. If you were coming in there as a Spanish speaker, you were expected to have a translator. They didn't have any way to translate for you. If you called in, they didn't have any way to translate for you. They just got lucky and they have a Spanish-speaking person there now, but they did not have a Spanish-speaking person there for quite a while.
Okay.
Yeah, and I honestly don't think that their website has Spanish, a Spanish translation on it.
I'm speaking of your clinic.
Yeah, that's what I'm speaking of as well.
Mhm.
Yeah, I don't think their website has Spanish translation on it either.
That's an issue.
Yeah. Mm-hmm.
It's a barrier.
Let's go you and then here.
Oh, okay. So in Georgia, it's the 6 weeks ban, is that correct? So what is the correlation between the heartbeat?
You guys want to answer
How
that?
does that, I'm assuming that keeps you from getting an
Correct, yeah. So typically, like around 6 weeks gestation, fetal tones can be detected on an ultrasound.
Not necessarily a heartbeat.
A heart is not formed at 6 weeks, so it's not a heartbeat, but that's like the colloquial like name of the bill that was passed. And it can be as early as 2 to 3 weeks. 6 weeks or less.
So if that is detected, that means that person can't get.
Correct.
Here.
Thank you.
Can you speak a little loud too, since you're in the back there?
So, question, especially in regards to recent jurisprudence that has come up before SCOTUS, regarding, and I see the parallels between what we were talking about regarding so-called crisis pregnancy centers and the conversion therapy, clinics or therapists that would offer, say, like a reorientation of sexual orientation between the right identity, and how they're likely to strike down like those laws, the prohibitions or restrictions in 27 states. and how that would be based on the same exact grounds as the defense of the crisis pregnancy centers on First Amendment grounds. Do you see some of the parallels between other parallels between those different cases as well from your perspectives with abortion?
Wow, that's a really good question. I don't know, because the thing about faith clinics is they operated like such under the radar for a while, and it's kind of separate from conversion therapy because it's so separate from any type of entity. Like any person can create a faith clinic. Like, just to clarify, so when I mentioned a medical director, they don't need a medical director at a faith clinic. They can just buy a storefront, put up a couple of posters, buy some pregnancy tests from the CVS, and open up a crisis pregnancy center. So it's a little like, and they operate like kind of under the protection of being a nonprofit. We're just trying to share our message, but it doesn't unless this scares out really bad. But it needs to get worse for it to get like kind of to that similar point. If people are going to have to be harmed, and I'm not saying like I want that. I feel like especially with legislation like the Faith Clinic STEM campaign, we can stop it where it is. But it's not the similar. Standing, even though like the issues are so similar. Using of religion to harm people based on like something they can't control, yeah, that's definitely like on the basis is very, the issues are similar, but when it comes to like the legality and policy is very different because of the way these two things operated historically until now.
Thanks.
Oh, we'll go here, then here.
How is the campaign going to fight against the fact that the current administration with the court gesture wants to make it illegal to travel between the states in order to get abortions?
Many municipalities have tried to pass, on like the local level, travel bans. They haven't been successful. For example, in Amarillo, Texas, there was a municipality that tried to pass a travel ban that nobody could travel through Amarillo to have an abortion. And they were able to fight it by basically like doubling down on that freedom message. Like, Americans don't spy on their neighbors, like that was their messaging. Americans don't spy on their neighbors, Americans don't like snitch on their neighbors, that we should have the freedom to move freely. I don't know that like, so our campaigns can't touch federal policy. I don't personally see a travel ban being successful on the federal level with federal judges in place. It's a really good question though, and it's something that could happen like here in Columbus. Somebody could try to pass that here in a municipality in Columbus. And that would be something that we would, have to tackle like at the Georgia level. But currently that's not like included in our campaign. But I'd love to talk to you more about like that campaign that happened in Amarillo. It's really cool. I'll show you like the stuff that they did.
And then we had a question.
Can I say something real quick? I'm in here all the time. I don't even know my So my question is based off what you said about the thought process of it has to get better before it gets worse. It's okay. I appreciate y'all. Still, so the thought process that has to get better before it gets worse. How do you think that y'all can change that mentality? Because I mean that is a common mentality among politics, among healthcare, among poverty. Most people don't feel the need to do anything before it affects them.
Oh, so to clarify, when I said what has to get worse, get better, I meant applying that specific analysis he did with the conversion therapy, that he said it would have to get worse to
So
get better.
realistically though, that's something that's happened though. We wouldn't have lost Roe v. Wade if people had like cared, but they don't. So how are y'all gonna change that mentality? Because nobody's gonna step up besides y'all. Because I mean, we watch politics, we all see it, people are drained, they're tired. How do you change that mentality? Because nobody can support you on the state level.
It has to get worse, get better. I meant applying that specific analysis he did with the conversion therapy, that he said it would have to get worse to
So
get better.
realistically though, that's something that's happened though. We wouldn't have lost Roe v. Wade if people had like cared, but they don't. So how are y'all gonna change that mentality? Because nobody's gonna step up besides y'all. Because I mean, we watch politics, we all see it, people are drained, they're tired. How do you change that mentality? because nobody can support you on that, on the state level, because they don't care about policies. They don't care about that because it doesn't hit home. My daughter, I don't have a kid, so my thought process isn't my kid is gonna need abortion at some point, so how does it affect me? Like, how are y'all as a collective thing, because y'all are partnering together, what is the thought process to change that, to get these people involved, to go to rallies, to be at the legislative meetings like city council in your local area, or going on the state level? Every one of us can step there, just as y'all can, but none of us have that motivation. So how do you gather these people to go with you?
We have a response back here.
Response to the back. Response to the back.
Just briefly, just to adhere to what you were saying. So I think what they're doing now is a great thing. This is how we're going to get people more involved. This is how we're going to advocate for reproductive rights. We got to get out. We got to continue to speak and let our voices be known. I know we get tired, maybe a little weird, but we got to keep talking. Otherwise, it's going to get lost by the wayside. Like Roe versus Wade, it's going to be another something. But it can stop today if we continue to put forth good faith and rally around each other, just put out the good message and the good word about our reproductive system and just our rights as a woman, as a person, as a human being.
I just wanted to add earlier, when we were talking about local politics, you really do have to keep a pulse on your local politics, because if you think about it, think of how many people start out small and then work their way up bigger, and things that they've supported. For an example, there's a guy here who's very involved in politics. He just keeps trying to get himself in the door. His name is Mark LaHoy. I think he's running for mayor again. He's running for mayor. He is regularly outside of the Pregnancy Resource Center. He is a major protester of abortion, constantly out there. Now, you may not know that about him, but I just told you. So now these people up front are going to be like, I'm going to tell 3 more people. And, you know, it does start out small. It does make a change. I understand your frustration. I am so overwhelmed, so deterred, so just over it, beat up, worried. But, you know, a lot of times you can just start out on a small level. Tomorrow, you know, this person might go to work and say, hey, I went to an abortion event at the library. Did you know they have a fake clinic with people that dress in scrubs in Columbus? And someone else will say, no, I didn't know that. And it just kind of, sometimes you just find the right thing that gets under people's skins and does get them motivated. You know, people in this room are motivated. So I wouldn't say, like, I understand I understand completely being frustrated and thinking that it's not going to get better, but I think the more that you are open to talking to people who are different than you, who are looking at things different than you, it will help. I mean, it does take time and it is very discouraging, but you know, they always say you can always just change the life for one person. So tomorrow you can go to work and talk about abortion and they can find out they can get abortion pills online and not get stuck with a pregnancy. So.
Here the panel.
Crystal wants to answer a question.
And then I saw the woman in purple after.
Oh, go ahead.
So one of the things I wanted to say about getting people to care, that is a culture thing and that is narrative, so you're correct, and everybody has been right in answering that. Thank you.
It's messaging. We have to get people to care in ways that matter to them. One of the things that we've been talking about more recently about abortion bans is that it's criminal. If there is a ban, then there is punishment. If there is punishment, then there is jail time. That's ridiculous. But also, abortion bans literally kill people that may want to have a child. And although we want to say that people should be able to get abortion for whatever reason makes sense for them, for some people we have to tell them, you are also in danger if you want to have a child next year. Because of what's in place right now, you can die. Doctors are afraid, because of the law right now, to offer care that is necessary, to offer emergency care. Amber Thurman, Candy Miller, there's a list of people we can name that I can't think of right now, but there are ways to convince people that are not entirely on our side that even if you don't care about my daughter, my niece, then you should be caring about you. And what happens when you want to have your child? You're still in danger, and not of a nebulous danger. You can die on a hospital bed.
And if you want your pregnancy too, whether you want it or not, you know,
Yeah.
you take someone like Adriana Smith,
Yeah,
you
exactly.
know, they're making the choice for you.
And then we got a question right here. I would also suggest, there's a book called Change, by the way, by Damon Santola. This explains this a lot, but go ahead.
It's sort of off of what she was just speaking on, and it has to do with religion. I guess, what kind of information are you guys targeting towards those that are in a religion that is for banning, and yet they have had miscarriages after miscarriages and miscarriages? Because I didn't know prior to, because I didn't have a miscarriage. I had 3 children, 3 births, 3 children. So, but when my daughter had 3 miscarriages, the language around what actually goes on with a miscarriage and what does that process, and so people can understand better, because I wasn't able to teach her about what that actually entails as part of the DNC and all the things that have to do with whatever stage that pregnancy is in. So what kind of things are you guys trying to put out that focus on there, so I can, like, my daughter's not gonna have any more children, but she could get pregnant, she has a husband. So, and then she's already lost someone in this. I'm afraid for her at this stage. So I just wanted to know.
Thank you. Let me just get over here. So thank you for your question. For a little bit of background, I work at Feminist Center for Reproductive Liberation with Chris. So we do have an abortion clinic down in Atlanta. So to answer your question, so I would say for, I think, the type of information that you were asking about, I would recommend, I don't know if y'all also do like education, but our organization, we do offer like educational workshops. So it really just takes like follows on Instagram or like sign up on our website, because we will offer these educations like online, and all you have to do is join. Maybe you join, maybe you and your daughter join, and maybe next time you tell your friend about it. And on these educational workshops, we can talk to you about like what is an abortion, what type of abortion sex is. Because I don't know if also all of you know the word abortion in the medical sense. They use abortion for either if it's a miscarriage or a chosen abortion. Because abortion just means like basically like emptying the uterus. So yeah, I would say approach other type of organizations too that do like educational workshops to learn more. And I hope that answers the question a little bit. Time for one question.
Raising your hand for a minute. I see you.
I was, sorry. Thank you all so much for coming. I was wondering about the maternal mortality review committee that was disbanded last year, and how information is being recorded, on these deaths, and like everything's dropping around me. How is the state keeping track of this information and these preventable deaths that are happening?
So the question was about the Maternal Mortality Review Committee that was disbanded. Happening, it was probably like a year ago now. It was disbanded because of a whistleblower who released information to a news media, ProPublica, about Amber Thurman and Candy Miller's deaths. The information was given out by somebody who was on the committee and did it without permission, so that people are knowing the effects of our 6-week ban. And we were told that it was disbanded, and we don't have any information about whether or not there have been more people put on the committee. It's a huge question mark. We don't really know. And we have that information because somebody was brave enough to give it to us. And it is basically only time will tell when we learn the names of people who have been affected by the 6-week abortion ban. I know that's not a great answer, and it's not an ideal answer, but we just don't know.